News of a new COVID outbreak at the Chelsea Soldiers Home is a reminder the virus still, of course, poses a threat, especially to older people. 15 residents and 10 workers have tested positive. And here to talk about the ongoing fight against the virus is Dr. Todd Ellerin, the Director of Infectious Diseases at South Shore Health. Dr. Ellerin, good to see you.
Hey, Dr. T, great to see you. So the Soldiers Home, if you remember, folks at home, if you remember, the Soldiers Home was the scene of an outbreak in 2020 that killed 31 veterans. There are no fatalities among these current cases. But what's the lesson we should learn, and what should we take now from this outbreak?
There are a few lessons we need to learn, Eddie, and of course, we're in such a better place now. No deaths as of this morning. But the bottom line is this: COVID has not disappeared. It's still here, and there are going to be clusters, just like we see this with influenza every year. But the good news is that most of these veterans were vaccinated with the up-to-date booster. That's key. Most of them are being treated right now. And so that's the reason that they're doing so well. We still need to protect our most vulnerable. The other thing I really want to emphasize is that the Department of Public Health really swooped in quickly and they executed their rapid response team. So again, kudos to the VA home in order that they messaged them early on so that they could get help. Again, these are all new things that didn't happen more than 3 years ago when there was a disaster.
Right. Well, Dr. Ellerin, you're talking about the importance of those boosters. The CDC, though, now saying more Americans are declining the boosters, just 20% of adults getting boosted. So what could be the impact of that?
It's really disappointing to hear, Erica. I think the key is that if only 20% of Americans have received the updated booster, then there are many vulnerable people that need it. Remember, immunity wanes over time. The virus, as you know, shapeshifts, right? So because of that, we want to make sure that everyone has gotten at least one dose of that bivalent booster. And for the most high-risk patients, those over 65 and the immunocompromised, you can get that second bivalent booster. Just remember, it's just added protection. It's true that, many of us have gotten infected, and that allows for immunity as well. But the best immunity is that hybrid.
Dr. T, just anecdotally, there seem to be a lot of people who are getting sick right now. We're not immune here at Channel 5. It's happening everywhere. And it's not COVID, but some people are feeling pretty uncomfortable. Is this a real trend that you are seeing in the hospital as well? And if so, what is making people sick?
Right, I can tell you, and I can't always say this, but at South Shore right now, our system is really strong and healthy. For the first time, just a few days ago, there was 0 staff of the thousands of people in our system that had COVID. I think right now there's 1 person. But that doesn't mean that, we don't get infections like everyone else. So what I would say to Channel 5 right now is do the smart things. They're common sense, right? If you're sick, stay home, especially if you have fevers. Whether it's respiratory or it's a GI outbreak, you really don't want to come to work. If you do come to work, make sure you try to distance yourself from others. Use masks if you have a respiratory illness. Those common things. Wipe down your keyboards. Don't share your iPhones. Those are the things that will keep us healthy.
And we are in the rhythm of doing those things over the last 3 years. So
Dr. Ellerin is saying it's us.
It's
us at Channel 5. We got to wash our hands more.
No, it's never you.
You're smart, though, Dr. T. Thanks. Great to see you. Take care.
Good to see you.